Welcome to the deep dive. Today, we're tackling a really pivotal moment in.
It sounds pretty extreme to us now, but
But
yeah, that was often considered the best path, maybe even the only path. It was the established approach for many.
but the authors of this study, they were part of a group exploring something, well, more proactive, right?
Absolutely. A strategy of directly bypassing the blockages surgically, going way down the leg, even into the foot artery sometimes, with the really bold aim of restoring blood flow and, actually saving the limb. It was genuinely groundbreaking stuff back then.
And I gather this wasn't exactly met with open arms. The sources mention quite a bit of skepticism, even like open disagreement at surgical meetings.
Oh, for sure. You can imagine presenting this seemingly radical idea.
Mm.
They were definitely swimming upstream.
Right.
These surgeons were suggesting pretty complex operations on patients often seen as, well, beyond surgical help, basically just candidates for amputation.
So how did they convince people?
Well, their initial successes were key. They meticulously documented over 2,800 cases, and they showed that the risk of the procedure itself, the mortality, was surprisingly low, about 3%.
Only 3%. That's lower than you might expect.
Exactly. And crucially, a big majority of these patients, 66%, after more than 5 years, they kept a functional limb.
So it wasn't just about survival?
No, not at all. It was about function, quality of life.
Hmm.
And this aggressive approach, well, the proof is in the pudding. They saw their own major amputation rates plummet.
Yeah, I saw that figure from 49% down to just 14% over 16 years.
Incredible, isn't it? That kind of real-world data, it really starts to speak volumes about this whole aggressive limb salvage idea.
Okay, so they're proving these bypasses can actually work, save limbs. But what about the pipes themselves, the grafts they were using to create these new pathways? That seems like the next hurdle.
Precisely. That's the next layer. The preferred material, and often still is, was the patient's own saphenous vein, your own tissue.
Why is that?
Well, it's living tissue, right?
Yeah.
Less likely to be rejected, generally has really good long-term results. What we call good patency, it tends to stay open, let blood flow for a longer time.
Makes sense.
But a lot of patients just didn't have suitable veins. Maybe they'd been used before, like in heart bypass surgery, or maybe the veins themselves were diseased, varicose, unusable.
Okay, so you needed alternatives.
You absolutely needed alternatives, and that's where PTFE, polytetrafluoroethylene grafts, came in. Around 1978, this synthetic option became available.
Right, the synthetic stuff.
Yeah, and the authors, they started using these when a good vein wasn't an option. And actually, they reported pretty encouraging initial results themselves,
Even for the really tricky ones.
even for those really technically demanding bypasses down to the tibial arteries, below the knee.
But the skepticism remained.
Oh, yes. Despite their own positive early data with PTFE, the wider surgical world was still, let's say, unconvinced, skeptical,
Some more pushback.
more pushback,
Yeah.
which really highlighted the need for, better evidence, more robust comparative data. And that's what directly led them to set up this landmark randomized trial.
Okay, let's get into that study then. The big one. 3 centers involved, right?
Yep, 3 centers. And they were directly comparing the gold standard, the patient's own saphenous vein, against these synthetic PTFE grafts.
Specifically for limb salvage below the groin. That infranguinal reconstruction, as you called it.
Exactly. Surgically rebuilding those blocked leg arteries. And some of the authors pointed out, which I think is really important,
What's that?
this study wasn't bankrolled by some big company or industry grant. It was driven purely by clinical need, by the surgeons themselves wanting to figure out the best way to treat their patients.
That really says something, doesn't it? That clinical curiosity driving it. So what did they find? What were the key results?
Well, the findings were quite nuanced, actually.
Mm-hmm.
For bypasses going to the popliteal artery, that's the main one just around the knee,
Right.
PTFE grafts did just as well as vein grafts for the first couple of years. 2 years, pretty much neck and neck.
Okay.
But after that initial 2-year period, the vein grafts tended to stay open longer. Their primary patency, as we call it, was better in the long run for popliteal bypasses.
Okay. So vein wins there long term for staying open initially. But here's where it gets really interesting, right? The limb salvage part.
Exactly. This is the crucial bit. Even though those PTFE popliteal grafts didn't stay open as long on their own.
The primary patency wasn't as good.
Correct. The rate of actually saving the limb was basically the same between the two groups.
How does that work?
Re-interventions. Surgeons could often go back in, fix issues with the PTFE graft, maybe angioplasty or stenting, or even redo parts of it and keep the leg viable.
Yeah.
So even if the first graft had problems, they had ways to maintain blood flow and still avoid amputation.
So the ultimate goal, keeping the leg, was still achievable at similar rates.
For popliteal bypasses, yes. Now, when they looked even further down the leg, to those smaller tibial and peroneal arteries below the knee,
The really challenging ones.
the really challenging ones,
Yeah.
there, the vein grafts clearly showed better primary patency. They just stayed open longer without needing more procedures.
Okay, so vein is definitely better there for staying open first time around.
Definitely. However, and this is such a critical point they made even in these difficult cases, the ultimate limb salvage rates were, again, equally good with both graft types.
After repeat operations.
After repeat operations, yes, and once the surgical wounds and any ulcers had healed up, the end result, keeping the leg, was achievable with PTFE too.
So even if PTFE needed more tinkering, more maintenance down the line.
You could still get to the same endpoint,
Yeah.
saving the limb,
Yeah,
which is, what matters most to the patient.
absolutely. And this leads us to what the authors themselves apparently called their heretical conclusion. I love that term. It sounds so defiant.
It really was, in the context of the time. It shows their commitment. Despite their own data showing vein grafts generally stayed open longer, especially way down the leg,
Yeah.
they firmly believed and stated that doing a PTFE bypass to those tibial arteries was still a worthwhile thing to do if the patient had no good vein and the only other option was amputation.
That's a bold stance, especially back then, saying, look, this isn't as good maybe on paper for long-term openness, but it's way better than an amputation, if that's the alternative.
Exactly. It was a pragmatic, patient-centered view. And they backed it up, didn't they? They mentioned dozens of anecdotal cases.
Right. And that incredible example, PTFE graft going all the way from the pelvis, the common iliac artery, down to the peroneal artery near the ankle.
And it was still open and working after 13 years.
13 years. You can just picture those skeptical surgeons from the early days hearing that.
Absolutely shaking their heads. But this persistence, grounded in their data, their willingness to really question the established way, that's what makes this paper so important.
It really shifted the paradigm.
It directly fueled the acceptance of this more aggressive limb-saving approach worldwide. What was once kind of radical became, well, much closer to standard practice in centers equipped to do it.
So let's sort of wrap up the main takeaway here. This landmark paper, it gave us that crucial head-to-head comparison, vein versus prosthetic grafts in these really tough leg bypass situations.
Yep. And it powerfully supported trying harder to save limbs, being more aggressive surgically.
And maybe most critically, it showed that even when the best option, the vein, wasn't available, PTFE grafts weren't just a lost cause. They offered a real chance, even way down below the knee.
It fundamentally changed the calculation for surgeons and patients, gave hope where maybe before there was just resignation to amputation.
The real aha moment for me thinking about this is just how much initial resistance they faced. That dismissal of these techniques early on,
Yeah.
it just hammers home how vital it is to do the hard research, to rigorously investigate, even when challenging deeply held beliefs. That's how you move medicine forward.
Couldn't agree more. They didn't just accept the status quo. They pushed, they gathered evidence, and they ultimately changed things for the better for countless patients.
And it really makes you think, doesn't it? You look at this paper from '86 and think about everything that's happened since then. Materials, science, surgical techniques, all the endovascular stuff we can do now.
Well, the field is completely different in many ways.
So what are the big questions today? What are the ongoing debates, the next frontiers in trying to make these grafts last longer and save even more limbs here in the 21st century? It's clearly a field that keeps evolving, building on this kind of foundational work.
That's the question, isn't it? Constant improvement.
Something for you to ponder. Thanks for taking this deep dive with us.